would you be willing to share some of the emptiness that you're facing now? And I think probably what's on all of our minds is particularly because you are a nurse working in a pandemic. And so if you wouldn't mind opening up a little bit of that current emptiness.
Yeah, and this is probably the question I prepped for the most. And so just definitely been praying that the Lord would communicate what needs to be communicated and not anything that's not glorifying to Him. I think one of the easiest ways to paint some of the emptiness that's here at the hospital is to go over a couple numbers really quick. So we currently have 3 floors at Lynchburg General that are dedicated to COVID, and 2 ICUs. And I mean, even this has never ever been the case with any kind of flu season. We've never had a whole area of the hospital dedicated to one thing. And I have a friend who works on one of the non-COVID ICUs, and they are completely full of what they call COVID graduates, which is an entirely cynical way of describing patients who aren't currently actively fighting COVID, but are definitely left with ICU level consequences of contracting the virus. So previously healthy individuals who are just emaciated and total care and will likely never recover fully and have the lives they had prior to COVID. The weeks of Christmas, the last week of the year, and then the first 2 weeks of this year were really, really hard weeks in the hospital for everyone. The first 2 weeks of the year, we went from 183 COVID-related deaths to 225. And if you do the math, that's more than 40 deaths in 2 weeks. And when you do the math as far as like what our census actually is, we were only at 130. We only have 130 beds for COVID. So we lost like 1 in 3 patients with COVID the first 2 weeks of the year, which was really not fun for anyone. And I feel in the emergency department, we get callous, I think, or in the ICUs, when you see anything a lot, you get callous to it. But a lot of nurses on the floors are not used to that. I had a friend who worked on one of the floors for a while, and she saw 1 code and death in her 2 years working on that floor. So then to go to 40 some odd deaths is just huge. So we definitely have yet to see the lasting implications of COVID on the mental health of our caregivers. A couple of weeks ago, a teenager came in and couldn't keep his oxygen above 70% without help. And he looked at me and asked me if he was going to die. And how do you look at a teenager or anyone and answer that question? People my age with no health history who develop clots and come in and it's too late and there's nothing we can do. Even we throw everything in the kitchen sink at it and there's nothing you can do. And it wears you down. It wears you down. And sickness and death are effects of sin in the world. And in His grace, God has given us ways to fight those effects and to push off death and to give people who haven't yet believed and repented opportunities to do so. I pray that in every single code I'm in. Like, Lord, if this person didn't know you, then bring them back and let us get a pulse and let there be brain activity and let them regain consciousness so that they can know who you are before it's too late. And so I'm grateful to get to stand in the gap for those patients, but it's not without a growing cost. There's increasing brokenness. And so, even my brain surgery included, I've never been more acutely aware of my own mortality and how temporary this life is. There have been few times in my life where I've felt so helpless and so invisible, and in many cases so taken for granted. It's hard to describe the feeling of, even though it's not meant personally at all, but the feeling of personal betrayal when how to put this kindly, when there are pushes to go back to life like it used to be, when life is not what it used to be anymore. I don't want anybody's rights or freedoms to be limited or infringed upon, but it does, it makes me feel really worthless and taken for granted when people insist on that over my safety and over the safety of the people who show up every day to try to push back this brokenness, and try to stand in the gap for people. And it's easy. I get it. It's easy to not live consciously aware of stuff that's going on when it doesn't personally affect you. People who haven't had somebody die of COVID or who've had somebody have COVID and get better, I get that it's easy to think that it's not a big deal, and to want to, go over to your friend's house for dinner and, to go back to things that we used to do and not take precautions. But prevention's the only way to push it back, because the virus doesn't discriminate. Once it's there, there's no telling. So lately my prayers have been filled with a lot of times when there aren't words to say. I really have taken comfort in the fact that Jesus is described as a man of sorrows, and he saw the brokenness and faced it head on. And so in the middle of this emptiness and brokenness that I carry as a nurse, and having been in the emergency department since the very beginning of the pandemic, and seeing community support go from like 100% and dwindling, and seeing people suffer, and the brokenness of families not being able to be with their loved ones, and how hard that is, and how inadequate I am to fill that gap for them. I only have scripture to hang on to, because every other comfort has been stripped away. Every other coping mechanism is not enough. So even when I don't feel it to be true, I know that the Lord has done great things for me. He saved me, and he sanctifies me, and he's given me altars like I described to look back on. And those experiences and those testimonies of the Lord's power and faithfulness make it look so much easier to look forward, because I may not know how tomorrow will go, but I do know how this story ends in the long haul. He's made so many promises that I can hang on to. So when I was in the hospital waiting for surgery, I memorized Psalm 46, 1-3, which is pretty neat because April also has a story with Psalm 46. But it says that God is our refuge and strength, an ever-present help in trouble. Therefore, we will not fear, though the earth give way and the mountains fall into the heart of the sea. And a lot of days lately, it has felt like that's what's happening. Life is so much different than it was a year ago. But I know that the Lord is faithful, and he continues to be our refuge and our strength. And so even in this current ongoing brokenness where I don't get what the Lord's doing, and all I see is the brokenness because I'm so close to it so often, that in the end we will overcome. And the Lord is gracious, and he's faithful, and he's here with me even when I can't see what he's doing exactly. I'm grateful for the altars that he's given me in my past to be able to face this uncertainty currently and as we move forward. So